Hello everyone, this is Dr. Nasser, and in this clip I would like to discuss beta thalassemia major. The field that you see in front of you consists of red blood cells that display a significant degree of anisocytosis. When you compare the smaller and larger cells in the field, you do see there's a significant variation. So high degree of anisocytosis, 3 plus or 4 plus, is called for. And you also see a high degree of poikilocytosis. There is a variation in the red blood cells. You do have schistocytes present, you have dacryocytes present, and there are target cells that are present in here. So there is a high degree of poikilocytosis. But these cells also are microcytic. When you look at the majority of the cells, there are occasionally one or two cells that are younger cells, are larger in their appearance. However, majority of the cell, when they are compared to the nucleus of a resting lymphocyte, these cells are smaller in size. So in this case, the MCV on the CBC results should run around 70 femtoliters. And also, these cells are hypochromic. You can see that the central pallor in many of these cells, even though some of them they might be young cells, are going to increase in diameter, which suggests the lower concentration of the hemoglobin inside of the red blood cells, which can be seen in values of MCH and MCHC when you are comparing the CBC results to the smear observation. So remember that you need to observe these morphological changes in different fields in order to be able to report those in your final report. I also observe a slight degree of polychromasia, which is expected in the case of thalassemias. The bone marrow will be hypercellular, and reticulocytes either is going to be normal or elevated. As we look at other fields, we do see that the various abnormal morphologies are repeated. We do have target cells in here. We have schistocytes. Hypochromasia is also present. Polychromasia is also present. We have an elliptocyte in here, and you can see that there is a high degree of poikilocytosis wherever in the smear we go. Again, schistocytes are present in here, dacryocytes are present in here. These patients who have beta thalassemia major, are quite often in need of blood transfusion. And it is quite likely for you to see nucleated red blood cells in the field when you're observing patient with beta thalassemia major. An example of NRBC, nucleated red blood cell, is in here, is orthochromic normoblast stage. And you can see again, even in this field, you have polychromasia, dacryocytes, target cells, as well as schistocytes. So my final report will include 3 plus anisocytosis, perhaps 4 plus anisocytosis, 3 plus or 4 plus poikilocytosis, as well as 1 plus dacryocytes, 1 plus target cells, 1 plus schistocytes, and 1 plus polychromasia. I also will make a note of the presence of the nucleated red blood cells. When I do the white blood cell differential, I will actually count the number of the nucleated red blood cells per 100 white blood cells and do include that value in my final report.